The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio on this Memorial weekend. Hopefully you're having a great time outside and really enjoying the day. If you're not, get your stuff out there and put a set of headphones on or listen to me on your phone and go enjoy the day. It's magnificent. It's really, really beautiful. But seriously, happy Memorial Day, and make sure that you understand what this day is all about and honor our men and women in uniform and those who have served us over pretty years, and extend your appreciation to them for their service, because of them, you get to enjoy this day. You know, there was, on my Facebook page, I posted a video, kind of a short little expose, if you will, and it was a picture of D-Day and the invasion of Normandy. Anyway, and you saw our men, our soldiers, being dumped on the shore and being gunned down and attacking the turrets and so forth. And it simply said, and then underneath that, there was a picture of all of us on the beach today and, you know, enjoying the water and so forth. And because of their beach day, you get to enjoy your beach day today. So keep that in mind and understand that much was paid for what it is that we take for granted. And it's very important. It's not just going to, and many of you go to the cemeteries and honor and put flowers on the graves of those who were in your family and friends that have passed, and you remember them in many different ways. But also remember what really, you know, started this all, and it's our armed services and protecting this country, this republic that we call the United States of America. Anyway, having said that, 888-630-9625. That's 888-630-9625. I'd love to talk to you. Got a couple of things I'm going to share with you today, and I think that you may find very fascinating. But if you have a question on anything that you have kind of rambling around your head about your health, today's the day. Let's talk about it. We're going to touch a little bit on sunscreens, and are they problematic for you, or are they going to cause you cancer? And I think you're going to find that all these products out there that have been touted to protect you may not be doing such a good job and actually cause the problem that they're actually avoiding or trying to avoid for you. I was reading an article yesterday and today, and this morning I was sitting around having a cup of tea and preparing for the show. And I was struck by a couple people that had weighed in on a topic of energy and fat and cardiovascular disease and so forth. You know, your heart getting all plugged up. Some of you know the name Gundry. He's a medical physician who, you know, has been touted as being one of the gurus in the cardiovascular and health arena, and people like Jack Wolfson, who is the paleo cardiologist. And I'd like to go through their information, but I was taken by a topic that was kind of being battered back and forth, and we're talking about lectins. You know, everybody says, lectins, what are lectins? And, you know, lectins are kind of an interesting area of investigation in that, you know, lectins have been shown to do a lot of bad things. And some people say, well, but they're good for you. Well, the jury's not out anymore. The jury actually is in and says that, you know, lectins, these proteins, if you will, they're kind of a protein. They're not a real protein. That they bind to sugar. They lock them in. And they are almost sometimes anti-nutrient. And they block absorption of patterns and so forth. And they can reduce your body's ability not only to absorb things, but to utilize certain macromolecules. And so these lectins, if we really want to describe them, they're carbohydrate binding proteins. That means they stick to carbohydrates. And these macromolecules, these large clumps of things, are highly specific for sugar elements, you know, of many different sizes and shapes. And lectins perform a recognition, if you will, on the cellular level, right down inside the cell, and they play a lot of different roles biologically involving your cells and how they express themselves and carbohydrate metabolism and so forth. And we can get into this, and you'll hear terms like phytic acid and solanine and proteoglycans and so forth, and they have very specific applications in the body. But just to toss them out there really means nothing. And unfortunately, a lot of your Fifth Avenue marketing, shall we say, are using these terms kind of frivolously. They put them out there, and because most of us don't get what they're saying, say, oh, really? They sound like really big words, and when people say them, we're impressed. Well, don't be so impressed. You need to really look at the behind-the-scenes situation. So lectins are a carbohydrate binding situation with proteins, okay? They block the absorption of certain nutrient bases, and they alter macromolecules, large bundles of molecules in their absorption patterns. Lectins are thought to have evolved as the body's natural defense, not even natural defense. They're evolved in a natural defense in plants, and essentially are toxins that stop animals from eating them. So if nature is so smart to put these things in so the animals won't touch them, then the question becomes, why do we put them in our bodies? And what's the problem? So, the question should be, so what do they do? Why are they so problematic? Well, lectins, as we said, they're a type of protein, maybe a carbohydrate type of attachment, but they bind to the cell membrane. And they're sugar binding. They draw sugars in, and they become what's called the glyco portion of this whole mechanism, glyco meaning glucose meaning sugar. So lectins offer a way for the molecules, these different substances in the body, to stick together like glue, without getting the immune system involved. And so it's kind of a protective basis, but it's a toxic basis, and it can cause damage. So remember what I just said. They stick together. Okay, so they can influence the inflammation in cell-to-cell interaction. So what does that mean to you? Well, lots of stuff, actually, because that sticking together thing means that they can stick to your arteries. And when they stick to your arteries, they begin to cause plaquing. And when they cause plaquing, what you see is energy begins to drop like a rock. You don't feel good. No matter what you seem to do, you think your diet is great. You're doing a really, really good job, right? And so subsequently, things aren't as good as what you thought they were, but you don't know why. What happened? I'm doing the best I can. But then you begin to know, about the intimacy of lectins. So, let's kind of recap, because it's really important. Lectins are a protein, or a type of protein, that bind to the cell. They're sugar binding and become this glyco portion of this glyco juggernaut situation, which is your blood sugar transport system. And lectins offer a way of molecules to stick together without getting the immune system involved. But that's the good news and the bad news. So this sticking together can influence how the cells react to each other and the cell-to-cell interaction. So lectins are abundant in different things. They're abundant in beans. They're abundant in grains. They're found in peanuts. They're found in things like eggplant, and they're found in bananas, and they're found in tomatoes and so forth. And so these lectins, if you will, they cause an irritation from binding and holding and storage. So you start putting on fat, you start clogging your arteries, and so when you look at this whole mechanism, and you know that they're found in dairy products, and they're found in eggs, by the way, and everybody's saying, oh my God, you've just taken my entire diet that I've been trying to be really good at doing. Well, lectins content in food is fairly constant. The genetic altering of plants has created some fluctuations. What am I talking about? I'm talking about GMO modifications. So as they began to modify your foods, and by the way, one of the biggest area of lectins are your grains. You were not meant to go and eat grass. When you see these wheat grasses out there, they pop in, to your different drinks. Those are really high in lectin, and they are not good for you. Golgi berries have high levels of lectin. They are not good for you, regardless of what the manufacturers say it's about. So lectins in plants are a defense against different types of microorganisms, pests, and different insects. That's why they are natural in those things. They may have also evolved as a way for seeds, if you will, the germinating portion, to remain intact as they pass through the animal's digestive system. So an animal eats these things, but the seeds don't break down, so when they poop them out, they get to plant. And guess what? They already have the fertilizer, but that's a different story. So lectins are resistant to human digestion. They can't be broken down simply because, and then they get into the blood unchanged. So these lectins, these sticky things that we talked about initially, right, can now start causing problems. So lectins are thought to play a major role in immune function, in cell replication, cell growth, cell death, and body fat regulation. So just talking about those things and the storage of fat within the arterial system and so forth, we're saying, maybe I better take another look at this thing. And what's it all about? So because we don't digest lectins and we often produce antibodies against it, body goes into fight, flight, alarm situations, almost everyone has antibodies to some dietary lectins in the body. When you take a look at what foods are that contain lectins, better yet, when you look at the foods that contain lectins, you see that they're probably ranked as some of the most allergic foods across the board. Obviously peanuts and peanut butter, right? People are allergic to eggs. They're allergic to dairy. You start going check. Maybe that's why maybe I'm not feeling the way I should be feeling. So this means our responses to different things vary dramatically. And, certain foods can even become intolerable for some people after the immune system has changed or the gut is injured. And if you're eating lectins, it can leave holes in your intestinal tract. These holes, what we lovingly call permeable gut. That means that there's a sieve-like effect in your intestinal system, so things are getting transported in without being fully digested. An inflammatory response kicks in, and you got other things as a result of that. There are some lectins, however, across the board that no one should, in my opinion, ever consume no matter what. And, you start looking at things and have you ever wondered why you don't see sprouted red kidney beans? And this took me kind of by a guess as well. Well, it's due to something called a phytohemagglutinin. It's actually spelled phytohemagglutinin, a lectin that can cause the red kidney bean to be poisonous. And so when you sprout it, and if you're getting that, you're eating poison. So the poison is usually caused by the ingestion of raw soaked kidney bean. Interesting, that causes the problem, right? So we're going to talk about what happens, but more importantly, we get in the second part of the program, we're going to talk about what you can do naturally to begin to reverse some of this stuff. We are such a carbohydrate and nightshade addicted society that we can't seem to get our heads out of it, and subsequently we're seeing increase of all kinds of things due to over too fat, heart disease, cancers, inflammatory responses, and this may be part of the puzzle. I'm the guy that's going to tell you, you got to look underneath the sheet a little bit to find out exactly what's going on, but this is worth looking at and see how your body reacts to certain things. I think you're going to find this really interesting. I know I did, and that's why I'm offering it. Our number here is 888-630-9625. That's 888-630-9625. Give me a call. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I am in studio on Memorial Day weekend. 888-630-9625. That's 888-630-9625. It's a beautiful day outside. It's a little hot, too. It's supposed to hit about 90-ish. So be careful. Make sure you're drinking a lot of water. Put a little sea salt in your water, and make sure that, you're out of danger, because some of us will get out there and say, oh, it's a great day, and we start doing all kinds of things, and we get ourselves in a jeopardous situation. Don't do that. 888-630-9625. We're talking about lectins and how they affect your body. We're going to talk about your energy pathways and your heart a little bit and why these things happen. As I said, I get into reading all the time, and I do it because I want to make sure that I'm up to date and keep you informed. And I learn things on a regular basis. Sometimes I think I know something, and then something comes out in a little bit of twist. And all of a sudden I realized why I saw the effect in a clinical setting with a patient, and I said, oh, that's what it was. Okay, got it, no problem. So then you can move forward and you can go from there. We talked a little bit about, the different lectins, then how they can cause fat deposition, how it can cause your intestinal tract not to work, called leaky gut patterns, increase, a side event from an inflammatory reaction because now you become more susceptible to allergens that are coming in your system. We talk about your heart plaquing, that these lectins bind, they become sticky, and then you have cholesterol that sticks to them, and then they clog up the arterial bed. There's been patient after patient that I've seen over many years that they come in our practice and we do hands-on allergy testing. We do it through neuromuscular function response testing, and we find that our clinical results are significant when it comes to that. But then we take them out, meaning out of their diet, and we change it, and we put them on all kinds of vegetables, and we put them on foods that are very high in polyphenols. We're going to talk about what that means when we come back into the second half. And we see patients actually begin to reverse their health problems, not only from places of degenerative disease, but also from a place of cardiovascular clogging. I've seen patients turn themselves around. They'll come in and say, well, I took another step and I did this. And we send them out to their doc and we say, why don't you go back to your physician and get that test rerun again. I'd like to see what your levels of blockage are now. And in so many cases, we're seeing, 30, 40, even up to 50% reduction in cardiovascular plaquing. It's like, oh my gosh, because in so many cases they were told that it's impossible. But importantly also just changing lifestyle, but starting with dietary patterns, their energy steps up dramatically. And that's a little bit of what we're talking about right now. These crazy things called lectins have a lot to do with it. But more importantly, what do you do with that? So, if you have a lot of joint pain, you have inflammatory reactions within the joint, you've done all kinds of things, you've taken, your turmeric and you've taken proteolytic enzymes and like that, and it's helped, but it hasn't gone completely the other side. It's, when a patient comes into our office, we look at their diet regardless of what the condition is. And we want to make sure that they're coached appropriately to get certain things out and certain things in, and sometimes in very high quality and quantities. So while many of the lectins cause negative reactions in the body, there are also some health-promoting side effects of lectins that can decrease the incidence of certain types of diseases. So now we're getting a little more complicated, right? I just told you all the bad stuff that can happen, but there's some good things as well. So the body uses lectins to achieve many basic functions, including cell-to-cell compliance or adherence. They need to link together. Inflammatory pathways, and that they modulate it because there's a programmed cell death that goes on, and that has to be done in a very specific manner. So you need to know specific things about lectins, okay? You need to know that lectins can cause bloating and gas and so forth. They can cause diarrhea, they can cause vomiting, they can cause irritable bowel. Researchers speculate that many lectins can cause an increased rate of bacterial food poisoning, and it may be as a result of the lectin poisoning itself. So you start saying, oh my gosh, so is there a magic wand across the board? Absolutely not. But we need to start looking a little bit more in depth, even as a physician, as a doctor, to know why patients get the great results that they get. I need to know on instead of a theoretical level, I need to know specifically. And this takes me to another look. It takes me to say, oh, really? So we have to make sure that we take that next step and we make sure that we turn it around in a way that we can apply it every time and not by guess. But lectins can cause extreme, reconstruction. Cells can't regenerate as fast as they should. So we need to take all this in consideration with each and every patient. Why do some patients with degenerative disease do really, really well? And why do some patients, even though they seem to be on the surface doing things that they should be doing, don't respond positively? We're coming up to the halfway point of the program. We have some calls. We're going to start getting to you. You're listening to Dr. Tom Roselle Live. We're here at 888-630-9625 on this Memorial Day. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio on this Memorial Day. Give me a call, 888-630-9625. That's 888-630-9625. As I said earlier in the beginning of the program, remember what Memorial Day is all about. It's because of our great men and women in service that we get to have the freedoms that we have in this republic and be able to express ourselves and to be able to do the things and have the life that we currently enjoy. Don't forget, make sure that you acknowledge that. And you see somebody out for lunch or breakfast or dinner this evening, why don't you pick up the tab for them? Just say thank you very much. I appreciate all that you've done for us. And remember those who have given the ultimate sacrifice and what they did. And just sit for nothing else. Just sit for a moment and look around you and see what's there and remember what it was that they did for you. Let's go to the phone. Steve, thank you for holding. How can I help you, sir?
Thank you for taking my call, Dr. Roselle. With regard to vitamin K2, I see that there's MK4, MK7, and I'm a little confused as to which is the best, or should they be combined? Or?
A lot of them are synthetic, so you have to be careful. Okay, so for example, if you just take the first three, K1, K2, K3, K1, which is a phyloquinone, if you will. Sometimes my tongue gets in the way. K2 is a menaquinone, and then K3 is a menadione. That's a synthetic, and they start going from that point forward. There's some fractions, but if you make it easy for yourself and just keep it.
Speak louder.
I'm right into the microphone, so hopefully you can hear me. K1, again, is generally found in plants and green vegetables, and it helps go to your liver and helps maintain healthy blood clotting. But the problem is that if you have a clotting problem to begin with, then you have to be very careful with K1. K2, so we also, I said earlier, is a menaquinone, is made by your intestinal tract, your intestinal bacteria. And that goes straight to the arterial walls and the bones and tissues other than in the liver. So if you did nothing more than understand those two pieces, and we could talk all day long on this, but K2 is probably for people who have to flip a coin. It helps prevent any hardening in the arteries. It helps maintain cardiovascular integrity. It works with making sure your bones are solid and so forth. But when you look at K2, and particularly with women and guys usually don't have the problem with osteoporosis early on as women do. But K2 helps prevent osteoporosis, and it works in tandem with vitamin D. There's a lot of Japanese trials. The Japanese are amazing people. They have done all kinds of work on nutritional pathways and oxygenation pathways and so forth. And they show that vitamin K2 completely reverses bone loss, and in some cases even increases the mass of the bone in people who have osteoporosis. It's really exciting. And, unfortunately, in this country, when we put things out there, we only give a little bit. Even the good guys, they only give you a little bit of the stuff. But there's a tremendous amount of evidence that came from, I think, 6 or 7 Japanese trials that showed vitamin K2 supplementation produced about, I think the number was somewhere 60-65% reduction in fractures of the bone, of vertebral fractures, and 80% reduction in hip and other vertebrae, of your spine, reduced their fracture levels as well. So do the research on it. So if I had to recommend one for a man without knowing you, I would say K2 is the one that you want to look at, and making sure that the intestinal tract is working, and supplementation level that's recommended is something in the neighborhood of about 200 micrograms a day. And I wouldn't exceed that unless you're working with somebody like our nutrition department that can really guide you. It goes on. K2 improves your insulin sensitivity, your insulin relaxation. It helps reduce bruising. It's a tremendous antioxidant. There's a lot of information that suggests also that Alzheimer's disease benefits by increasing the level of K2. We use it on an ongoing basis in the office with other things, depending on the condition that we're trying to modify. Foods, you have, like things like lamb and beef and dark turkey meat and so forth have levels. Some of your highest is natto. Nattokinase is one that will help reverse arterial plaquing, by the way. Again, like I said, we could go into this for the rest of the program, and I can't take away from, what we're talking about, but I hope that gives you a little bit. But, taking drugs like a broad-spectrum antibiotic or a cholesterol-lowering drug and so forth dramatically increases your risk of vitamin K deficiency. And so you have to make sure that, you take all that in consideration. Does that help you, Steve?
Well, within vitamin K2, there's sub
yes,
MK4.
Yes, absolutely. But what I said to you then initially, those are all subfractions of this. But to understand how they work, you have to understand K1 and K2.
Right.
Okay, but to go out and take the subfractions is not appropriate. You want to take it as a whole product. I hope that helps, Steve. Thank you for calling. Appreciate it. Joan, thank you for calling. How can I help you?
Hi. Yeah, I've been attacked by hives.
Oh, not a good thing.
No, I know. I've had it now for 3 weeks. I've gone to 2 different doctors.
Okay, so what
I still have it.
So besides cortisone, what have they told you to do about it?
Really, nothing much. They told me to take. Let me look at what the bottle says.
John, let me ask you a question.
Zantac.
Yeah, don't worry about that. That's calmative. Let me ask you a couple quick questions. Have you ever had problems with the hives before?
No, never.
Okay. So
I'm an old dog.
Okay, so there's a couple things that may be going on. It's generally when you see hives, you look at 3 primary systems: the intestinal tract, the liver, and the adrenal system, fight-flight system.
And the what system?
Your adrenal glands.
Oh.
And so first you would go to look at what the diet's been that may be different within 30 days going into the breakout of the hives, particularly within about a week or so. Anything has changed. And I'm not asking the question. I want you to ask yourself that question. And if there's anything that has been altered, has there any nutrients been added? Have you taken any medications differently within that 30 days that you weren't taking before? Because a lot of them will cause hives.
Oh, really? No.
Yes, and so the interaction of those things. So you have to be careful with that. Even things that you wash your clothes with, things that that you brush your teeth with, and so forth. All of those can be sensitive reactions to it. So what I would go do is I would take a look at the last 30 days or so of what your environment's been like, see what's taken place. I would go out and if you're not allergic to dairy, go to Mom's or Whole Foods and get yourself a good probiotic that'll support your gut. Make sure that you're not getting too many grains, because we're talking about lectins, and lectins can cause this type of reaction, by the way. And see what's there. You want to clear your diet and probably go to basics for a period of about a week and just see what happens. Go to green leafy vegetables. Make sure they're. I wouldn't even eat them raw at this point. I would eat them slightly cooked.
I always eat them cooked.
Okay,
yeah.
And then make sure you're eating rough, good fish, free-ranged fish, Alaskan salmon, things like that, and see if that begins to change over a period of a week's time. Stay away from the wheat products. And my mantra: sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products, particularly GMO modified foods. See if that begins to change. Increase your vitamin C level, and take about 1,000 milligrams twice a day is not going to be a problem. The only side effect of way too much vitamin C is that you might get a little bit of an irritated gut. If that's the case, you back it down a little bit, but it's not going to hurt you in any way. I would start drinking some organic green tea. It's very, very high in polyphenols. We're going to talk about that in a minute. But try those things. And if we can be of further help, reach out to our nutrition department and see what we can do to suggest you further. Joan, I hope that helps you. Thank you for your call. Appreciate it. 888-630-9625. So hives, we have an inflammatory reaction that's affecting the skin, and it can be from any of those things that we just touched upon. And you have to be very careful when things happen. It's always appropriate to see what's different, to see what's, medications. Did you add something? Are you taking a nutrient? Even good nutrition, you're taking supplementation. They're not all created equally. And if it doesn't say on the, organic, non-GMO, you're getting things in your body that may not be supportive to your system. So you got to take a look at those things. What did you add? What's different here? Am I being exposed to something? Did I go out and have something I haven't had in a long time? And that was the straw that broke the camel's back. But these, we're talking a little about lectins and how they can affect so many different systems in the body, and it really cause some monumental problems. So let's go back just a little bit, and these culprits, these lectins that have a tendency to cluster together and clump together, and that's what causes arterial blocking. They're categorized into a whole group of substances called anti-nutrients, and since they block the absorption of other nutrients, and not because necessarily they're problematic by themselves, except for the fact that we talked about they can be poisonous, like in red beans. When they're sprouted, then they're poison to you. Lectins can cause your stomach to be upset, and because it irritates it, it can cause you to have a leaky gut. So there are reasons, many, many reasons why these can be dangerous to eat, particularly when they're undercooked, and specifically in bean form. You don't want them necessarily sprouted. So let's talk a little bit about the highest food concentrations before we get to the fix. So things like wheat, any kind of grain whatsoever, period, end of story. Any kind of nightshade, which is your peppers and your tomatoes and things of that nature. Red kidney beans particularly. Soybeans, get rid of them. I'm not a fan. They have these things called phytoestrogens in them, and they can cause all kinds of problems. They can set the stage for cancers. Even if, the Japanese, and say, well, they eat them in Japan, they eat them in Asia. When you go over there, and I've been, I've gone to Asia a couple times, I've trained in a couple clinics over there, they don't eat it the way we eat it over here. They're natural sources of it, and they eat it just a little bit. But these estrogenic-bearing substances are not something that we should go out and drink a glass of soy milk every day or add soy milk to our coffees and our teas and so forth. They're dangerous when you do it at that level. Peanuts and tomatoes and potatoes and bananas and things like that, and eggs, as we talked about, and dairy products. All these things have lectins. So even if you've tried to clean up your diet and it's not working, you want to see what you may be doing in this arena. So lectins can cause leaky gut because they leave holes in the intestinal tract because they're irritants. But is there a purpose for lectins? Well, the chief function of a lectin in an animal is to increase cell-to-cell contact. A lectin usually it contains 2 or more binding sites for carbohydrates, these rapidly producing sugar units, right? So some lectins, cause these sites to be unavailable, if you will. So other things can't get to them. So your blood sugars are going to go up. You're going to store fat. You're going to store fat in your arteries and so forth. Your energy is going to go down around your tubes. It's going to affect your thyroid. Across the board, it is not a good thing. Let's go to the phones. Charles, thank you for calling. How can I help you?
Yes, I've been having a pain in the front of my right thigh and went to the orthopedist, and she diagnosed it as hip flexor tendinitis. So even though I don't get the pain in the hip, it's translated to the leg. And she recommended to get some physical therapy, including dry needling, and I wanted to find out what you thought of that, and also whether there's anything I could take orally or topically to help.
Well, it depends what it comes down to. Remember, tendinitis is just an inflammation of the tendinous insertion of the muscle. It doesn't tell you why the problem is there to begin with. Now, when you're talking about the thigh, your quadricep muscle, it's a 2-hinge muscle. It goes over the top of the knee, and it starts up at the insertion of the leg into the pelvic structure. So when you lift your knee up, you're moving your hip. When you extend your leg straight, you're moving your knee. So, and different nerves from the spine go there. The upper portion of that muscle is innervated by the first, second, and sometimes the third, but first and second lumbar nerves that come out of your low back. The lower portion is number 3 and 4, sometimes 2, 3, and 4. Again, there's this thing called post-ship and, prefixed neurological system. So, but that's the area that it's coming from. And so it can be that. It can be as a result of the foot, the arch being dropped. And if that's the case, then it's going to move. It's like, the ankle bone's connected to the knee bone's connected to the hip bone and so forth. And that can be an irritate. It can be that the hamstring is not balancing the quadricep properly. And so the hamstring has to be checked as well. Dry needling, and I have a real problem with dry needling. And some things it's very effective. What they're doing is they're breaking up trigger point responses within muscles and tendons. And most of these PTs are going out and taking a weekend course. I'm a licensed acupuncturist as well as one of my the rest of the credentials I have, and I have 3 very trained acupuncturists in our office. And there's ways of doing that. Sometimes it works if it's purely a trigger point response to a muscle that's been overcontracted. But here's the situation: 80% of all your muscles that seem to be too tight, it's the opposing muscle that's really not firing properly, so it's too weak. So what I would say to you is this: you got to find out what's causing it. And I'm not sure the PT is going to be able to do that. You get to a chiropractor, call our office or somebody that you're comfortable with and get them to check it out. That can be resolved, if you focus that. We treat a lot of the NFL. We treat a lot of, the professional athletes in the Washington area, and it's not just generally a very simple, straightforward thing. Charles, if I can help you in any way, give our office a call, talk to one of our guys. They'll take the time and they'll move through the scenario with you, and then you can make your decision accordingly. Appreciate your phone call. Thank you. We're coming up to that part of the program. We'll be right back. Don't go away.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. You're listening to Dr. Tom Roselle live, as you do every Sunday on the Eastern Seaboard at high noon, 12 o'clock. And those of you listening in other places, thank you very much for finding us again. Our salute to those men and women who have served us so well, and some having given the ultimate sacrifice for our republic, for our country. Today's Memorial Day. Please reach out and remember as many people as you possibly can for the service that they have given you. And the fact, as I said, that video that I saw and posted on my website is simply that their beach day, an invasion of Europe years ago during World War II, allowed you to have your beach day today. Enjoy your day, but remember them as well. Promise you I'd talk a little bit about sunscreens, and actually this is another area we could talk about for another hour or so, but here's the situation. You have to make sure that you do your research, because there's a lot of sunscreens out there that will actually increase your problem and actually make things much worse than trying to resolve the burn and the blocking of skin cancers and the like. You need sun, and you need direct sun, but you don't need it to the place where you're scorched. So, when you go out in the sun, that as soon as you get that little redness in your skin, it's time to cover up. But you need to get that little redness to stimulate the vitamin D levels in your body. Unfortunately, because of the amount of lotions and oils and soaps and sunscreens and so forth, it can be problematic, and we don't get that. There's some decent sunscreens out there that are less problematic, if you will, than others. If you go to some of the Aveeno Baby Continuous Protection lotions, they're not too bad at all. Badger Active Natural Mineral Sunscreen is a decent one. There's one called All Good Sun Stick, and that's not bad. These are all 30 blocks, and they work fairly decently. And if you go in and you really look them up and you look for a natural sunscreen, coconut oil taken internally with vitamin D levels and so forth, and vitamin K, by the way, as we talked about earlier in the program, can help protect the skin. You've got to be careful with some of them because they have high levels of certain types of metals, and that can cause skin damage. It can actually increase the ultraviolet radiation into your body. But check them out, do your homework, and I think you'll find that, if you really look through it, and there are problems with many of these sunscreens. The worst ones out there, I'd stay away from, my opinion, and this is my opinion, stay away from Banana Boat, stay away from Coppertone, stay away from the Neutrogena Wet Skin Kids Stick Sunscreen. There's a lot of problems with some of these things. And some of the overall offenders, if you will, are things like Panama Jack, CVS Health Sensitive Sunscreen. Again, if you go through and you check the listing of these things and you ask yourself the question, why did he say that? You're going to see it. But those are, in my opinion, based on the evidence that we've been able to come up with, are some of the worst. So be very careful. You need to have some protection. A lot of times is wearing clothing that will block it, or being smart and staying out of the middle of the sun. Don't go out there and expose your skin all day long, to the sun rays. Moderation is the keynote when it comes to sun. We all need sun, but we have to be careful with the amount of exposure that we allow our bodies to have, because otherwise those things that we're trying to avoid, if you will, are going to be our outcome, and that's not okay. There was an article that says 67% of sunscreen products, that were reviewed didn't work, or they had inadequate protection from the UV rays. That's huge. So that tells you you've really got to figure it out, and you have to look at stuff. Understand the penetration levels, understand what they can possibly do, and then be smart. We didn't get into the polyphenols, but I'll tell you what polyphenols are those things that are going to help cellular repair across the board. Vitamin, all your berries, your blueberries, your blackberries, and so forth, and your...
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.